to tune into this webinar. I'm going to talk a little bit about chronic care management before I pass along to Michael Knipper from CareMerge for the rest of the presentation. Just note we are recording this webinar, and we'll send the link of the recording version after the conclusion of this presentation. My name is Mark Dabeck, and I'm a training specialist here at Amazing Charts. For those of you who are not familiar with chronic care management, there's a new CPT code recently introduced that allows you to bill based on face-to-face encounters with your Medicare patients that qualify by having 2 or more chronic conditions. We did a lot of research for putting together this new chronic care management service for our users. We vetted many different organizations that specialize in CCM, necessary documentation, and efficiently getting it to your EHR, where it is required to be qualified. We vetted about 12 different companies and going through product demos, client success rates, and various components to find the best match with Amazing Charts. We wanted to find a company that fits seamlessly with our company's ideas of usability and affordability. And through that research, we discovered CareMerge. CareMerge has high success rates, easy to use, and they have great knowledge and understanding of the CCM program. So we started developing on an integration between the 2 products so that you can seamlessly integrate with your documentation in your EHR. And we have already introduced an educational process to get you trained and up to speed so that you can start billing, getting paid, and become more profitable while also creating a great experience with your patients. Our hope with this service is to improve your population health with better outcomes, spend more time with your patients with chronic conditions, and provide better care with these patients. With that, I'd like to pass it on to Michael Knipper from CareMerge, who'll go into a little bit more about the evolving landscape of chronic care management and how it affects your practice. Take it away, Michael.
Thank you, Mark, for the introduction. As mentioned, my name is Michael Knipper, and I will be leading today's webinar on chronic care management. We're going to discuss today the evolution of chronic care management and some of the more important changes that are in store for 2017. These changes are meant to help facilitate implementing chronic care management in your practice by easing some of the current regulations while increasing current reimbursement rates. In addition, there are some new CPT codes proposed to take effect in the new year that will further incentivize your practice to move forward with the chronic care management program. I will discuss these in detail with you today and explain that chronic care management will have a direct benefit on the value-based reimbursements that will affect most practitioners in the new year. I'm going to provide a brief overview of the chronic care management program today, what CMS is looking to achieve, what a practice can expect based on their patient population, and how easy it is for practice to get started with the program. As you can see here, the CPT code for the reimbursement of 20 minutes of non-face-to-face care coordination is 99490. The national average for 2016 is a little bit over $40 a month. As you can see on the slide below, we have a proposed change for the coming year of an increase between 3.3 and 3.7%. This is really a solid endorsement moving forward and increasing the reimbursement rate for practices that are participating in the program. In addition, there's currently an enrollment process in place where a consent form must be signed. This is an agreement between the patient and the provider authorizing chronic care management services. It's an internal document currently. It is not submitted to Medicare, really outlines the specific activities that the practice is going to be providing for the patient, what the patient can expect. I'm also going to touch on that a little bit later in today's webinar. Another point I want to make is that only one provider can bill per patient. As any primary care physician can attest, that a patient of theirs might have 3, 4, 5, maybe as many as 7 different specialists. Only one provider can bill per patient. So that's a really important point. The consent form addresses that today, and I'll discuss the changes with that consent form a little bit later. So we have a map here. As you can see, there's approximately 36 million eligible Medicare patients today. And only 275,000 unique patients have been billed for this reimbursement as of June of this year, so roughly 18 months into the program. The program is still in its infancy, as this amounts to less than 1% of the total patient population. The number of Medicare patients is due to increase to roughly 50 million or so in the next decade, as 100,000 new Medicare patients are added each and every day. So the potential patient population is only going to increase. It's not going to change. The demographics are moving forward. Your Medicare patients or Medicare patients are going to become an ever-increasing amount of your practice. A few questions to ask yourself. How many Medicare patients do I currently have? And are the Medicare Advantage plans that I accept reimbursed for the Chronic Care Management Code 99490? More and more of these plans have followed Medicare's lead and are participating in the program. This is going to provide a greater number of eligible patients within your practice. The common goal of the Chronic Care Management Program is to improve outcomes and in turn reduce hospitalizations and lessen readmission rates. CMS is going to benefit with lower costs if a number of your patients are not admitted or readmitted in a given year. The patient is going to benefit by the enhanced care you're providing, and the practice is going to benefit by generating an additional revenue stream for work that they and their staff have been providing on a daily basis. So this is very, very important. Last year, 2015, it was strictly a Medicare program. Very few Medicare Advantage plans were participating. They're seeing the success, the benefits that they're looking to achieve, and more are coming on board. So what we're recommending to find out that information is for somebody within the practice, pick up the phone, call the top 4 or 5 Medicare Advantage plans that you're currently accepting, and just inquire, are you reimbursing for 99490? They're going to give you a definitive yes or no. If the answer is no, do you have any plans on the horizon to start reimbursing? So very easy to get that information, and you're going to be able to ascertain how many patients that you feel you would have eligible within your practice to participate within this program. Just to reiterate, this is a brand new program for most practices. Understanding the requirements and what constitutes being compliant have been the initial concerns for most. Patient feedback has been very positive due to the added outreach. And regarding the tracking of time, the concerns of development of a care plan, this being time-consuming, we have created a tool to easily and efficiently capture and track that required time, create, maintain, and edit a comprehensive care plan. You are already providing this. We want to make it as easy and efficient as possible. So all of these previous concerns that practices might have been thinking, it's just too hard to do, it's too difficult, that is not the case. We're able to show you how easy it is to incorporate this as part of your everyday workflow process. So what are the real barriers today for chronic care management? We have found that the most successful practice is the one where the providers and the staff are actively engaged from the very start. With everyone on board, the implementation of the chronic care management program is easily established as part of your everyday workflow. The way that works is that you would assign a main user, somebody that has oversight, getting everybody on board. And we found with this in place, it has tremendous chances of succeeding and benefiting your practice. We're going to discuss some of the core requirements of the chronic care management program in the next set of slides. Going back to some of the basic items, 2 or more chronic conditions. So your Medicare patient must have 2 or more chronic conditions to enroll and participate in the program. Based on CMS statistics, roughly 70% of all Medicare patients fall into this category. Many of your patients that you see might have 4, 5, 6, or maybe as many as 7 different chronic conditions. So one bit of information I want to stress is that 2 or more to comply for the program to be eligible, but in the establishment of the program, they want all of their chronic conditions to be addressed. And this is something that you are already doing on a daily basis. So this is one of the requirements to determine your eligible patients. 24/7 access to the care team. So this has been brought up. This is one of the requirements that CMS has, that your patient, once they enroll, it is stated on the consent form that they would have 24/7 access. So again, this has been a concern, thinking that the patient is going to call them all hours of the day, the weekend, the middle of the night, for basically any inquiry at all, and that would be to satisfy the requirement. Based on the concerns of practices that are involved, or perhaps a practice that was hesitant about moving forward, for 2017, you could see that the access to care is changed for urgent needs. So this just falls into line currently what you have, where a patient would call if it was after hours or during the weekend when the practice is closed. They would be contacting strictly for urgent needs regarding this program. So this is a very, very important change. Practices are very happy to hear this, and it just falls into line what you're currently providing today. The time requirement, I touched on this briefly for the CPT code 99490. There must be a minimum of 20 minutes of non-face-to-face care coordination time. An example I like to give, and if you look at the chart here, it says contact-based care. So what I like to say is, if the main provider or a staff member ends up looking at the incoming lab results and no further action takes place, they just file it away, that would not count as billable time. But if the main provider ends up reviewing those lab results, speaking or coordinating with one of the internal staff members, whether it was a certified medical assistant or one of the nurses, who then followed up with the patient's family member, the pharmacy, all of that time would count from beginning to end. So that's where the contact-based care comes. As you can see, it's doctor to doctor, doctor to any staff, outreach to any care coordinators, any of your ancillary providers, the pharmacy, whether it's by phone or electronic communication. So this is important, really easy for the practice to understand. Any questions that come along during the process, you have a dedicated CCM support team to get you on the right path, to explain what counts, what doesn't count as a billable time. So if you see underneath general planning time, just to reiterate or reinforce what I said, general planning time does not count unless it is initiated by direct contact. So very straightforward and understandable. The care plan. Currently, CMS does require that a comprehensive care plan is established and maintained for every patient that is enrolled in the program. They do require that the care plan is reviewed on an annual basis. So I'm asked constantly, how many times do I have to edit the care plan? How many times do I have to update it? They ask at a minimum that is reviewed annually. But of course, if there were any occurrences with the patient, any edits, any additional problems, that the care plan is responded to and updated to the most correct status. So on the third bullet point down, you will see that it says ensure the care plan is available electronically at all times. This again, going back to another 24/7, that everyone has to have access to the care plan 24/7. It has to be available. The proposed 2017 change is that the care plan is now to be shared in a timely manner. Previously, fax transmission was not allowed unless it was extreme circumstances. But now fax transmission could be the standard form for sharing that care plan as opposed to electronically. So another important change for 2017, looking to ease those burdens and requirements for the practice. The consent form, I had talked about this previously. These are a couple of the items that are listed. This is personalized. We do create this for you. We provide you some talking points to help explain the program to your patients, as most of your patients that are walking in the door have never heard of this. As you can see, going back to the 275,000 patients billed out of 36 million, it's less than 1%. Most are never going to hear about this. You're going to explain the benefits of the program. This is the current consent form. The proposed 2017 change is going to eliminate the need for written consent. So the way that would work is that a patient would walk into your practice. It would be a face-to-face consultation. You would still explain and provide the required information to the patient verbally, and you would document in your medical record whether they enrolled or declined in the program. So eliminating the written consent, that is going to be proposed for 2017, taking effect January 1st, which is not that far off. So another important change, you would just have to document in your medical record you had provided the patient the necessary requirements and they either enrolled or declined for the program itself. So here's some great information we're going to touch on now, some additional CPT codes proposed for 2017. I had mentioned the 99490 CPT code, which was for 20 or more minutes of face-to-face, non-face-to-face care coordination. So I always get asked, Mike, what happens if I have somebody at 40, 60, 80 minutes? Can I bill this code 2, 3, 4 times, multiples of 20? In any case, it was 20 minutes or more, irregardless of time, it's one reimbursement. So just to touch on the top one, I mentioned a face-to-face introduction. The patient would be coming into your practice. You or a member of your staff would speak to the benefits of the program, explain to them the chronic care management program, provide an assessment, and discuss their care plan development while they're in the office. So you're able to bill for that initial visit, the purpose why that patient came into your office, and now you're going to be able to bill concurrently a separate code for this initial consultation for the program and the care plan development. Previously, you were not able to bill for that, but now you're able to have an added charge, and that's based somewhere in the ballpark of $63 plus or minus based on locality. Another real benefit for getting started with the program. This is looking to take effect January 1st. Again, you will be able to bill for that initial introduction, explanation, assessment, and care plan development to the patient. Touching on the 20 minutes or more, we have two new codes. The first one is 99487, and now this is for your complex chronic care patients. You have probably a handful in every practice that is listening here today where you're spending 60 minutes or more of non-face-to-face care coordination with some patients. You're going to provide these activities anyway. It's going to continue to occur, but now CMS is going to incentivize you by providing you a higher reimbursement rate for these complex patients. The proposed reimbursement rate for this code is somewhere in the $93 range, plus or minus, again, based on locality. And they're also going to have an add-on. Each additional 30 minutes that you spend over that 90, again, you will be able to bill somewhere in the ballpark of plus or minus $45. So this is really important. I'm going to touch on this again. You know, that we do have the 20 minutes or more. It was one reimbursement. Now you're going to have 3, plus the additional of the initiating code that is listed at the top. If there's any rural health clinics that are participating, there was previously an indication that there had to be direct supervision from the provider, and that's going to just change to general supervision, and that's for the federal health clinics as well. So a lot of changes coming in store in the next few months for 2017. All of these are really to ease the burden, ease the requirements, and further incentivize the practice to move forward. One thing I want to touch on, spend a little time here is, you know, have you heard about value-based reimbursements? You all have. So in 2017, this is going to affect all solo practitioners and groups with 2 or more providers. The value-based reimbursements are going to be based on the 2015 numbers for your practice. Implementing chronic care management now is really a win-win. So the first topic is you're going to get reimbursed for the time that you're spending coordinating care, improving outcomes. But secondly, this is going to help fill the gaps between those regularly scheduled visits that your patient already has. So if you have a patient that's coming in 4 times a year, let's just say every 3 months, filling in that void, filling in the gaps, improving outcomes, catching something beforehand, this is going to help avoid as far as hitting that negative penalty. So you can see where the two programs are coming in. They're tied hand in hand. This is a very, very important feature. They do work well together. So we found that with the practices that are already implementing, they're catching items between those regular visits. They're being proactive, and this is definitely going to have a benefit on improving outcomes to avoid those negative penalties starting in 2017. In 2018, it's going to affect the physician assistants, nurses, and the other providers that are able to bill. So 2017, it comes full steam. 2018, it's going to affect everyone with the value-based reimbursements. This is a case study of an Amazing Charts client. They had signed up with the CareMerge Chronic Care Management Program in February of this year. Very, very strong rollout. They have approximately 600 potential Medicare patients. They ended up enrolling 300 in less than 90 days. So we're finding very strong, similar results with most practices that they are enrolling patients. There is very little apprehension to move forward when it's explained to them what the benefit of the program is, what the goals are, enrollment. And the practice has been very, very happy. We have this case study. You could feel free to contact your Amazing Charts sales representative. They'll be able to provide you a copy, go over and see one real-time account on how they are performing with the chronic care management program. I don't know if you could see it in the bottom left, but the doctor has a quotation stating that the training was so thorough and succinct because the platform is just so easy to use. I've mentioned that several times. I'm going to reiterate that over and over. Ease of use and efficiency is what we're looking. You're doing this. It is not difficult to implement the chronic care management program. So, here's a testament to an Amazing Charts client such as yourself and their experience with implementing the chronic care management program. Next, I'm going to touch on implementing chronic care management in your practice. A few points. So Amazing Charts and CareMerge has put together some very advantageous benefits for your practice to get started with the chronic care management program. Again, reaching out to an Amazing Charts representative, they're going to be happy to discuss these with you, how easy it is to get started with the partnership we have created. They'll be able to schedule a demo with you to show you exactly what a member of your staff would be doing to get started with this program. They're going to explain the current consent form process. They're going to explain as far as the implementation and the integration between the two systems. So there is a lot of benefits. We make it easy to start, very, very low barriers, and you have a dedicated team to help you be successful. We don't just sign you up, here you go, and good luck to you. You're going to have a partnership and a dedicated team to help you move forward, hold your hand, explain anything, and be there for support. So very, very encouraging for that to be successful. Again, just touching on, we want to make this a very simple process for any practice as you're currently providing most of these activities on an ongoing basis. Ease of use, efficiency is stressed, as I've said many, many times. We're able to create custom care plans to satisfy the CMS requirement. You're able to track and capture any non-face-to-face activities. Being that anyone will be able to sign in, you're able to see the status of any patient very easily. You're also able to schedule tasks, what we call to-dos. So you're able to coordinate care and manage activities for your staff, assign tasks for this patient population. Very, very great control. You're able to collaborate and communicate with any of your ancillary providers. We also have a HIPAA-compliant family and clinical messaging app that is available if you wanted to institute that as well. So a lot of bells and whistles with the chronic care management program to be proactive and engage with the patient population. So since most practices are new to chronic care management, we're the help there to build this program with you right from the start. Mentioned already, you are going to have a dedicated CCM team. We assign an individual to your practice. We try to get a main user from your practice that we're able to communicate, provide encouraging enhancements, new production, discuss any feedback that they may have. So you're going to have a team here. We have the initial training where after this training is done, it's about an hour's length showing you how to get utilized with the platform. Staff members are able to get started right from there. They're able to dive right in, start creating care plans, tracking notes, very, very simple. There is not a long learning curve to moving forward on this implementation. We have a couple follow-ups for feedback, for any reviews, for any questions, going over the multitude of reports that are available for you. We're also able to provide any goals. So X amount of patients that you have enrolled in the program, how many are getting billable time, offering best flow workflow process. We're there to help provide solutions for you to move forward and be successful based on our experiences. So sign up. Once a practice signs up with Amazing Charts for the Chronic Care Management Program, you're going to receive a series of items to put you on the right path. We have a CCM Made Simple packet. This provides you some very handy reference points that you can refer to in addition to your dedicated CCM team who you're able to call, but it has some nice features you can look back on for any quick questions. We also provide you a brochure that you're able to print out and place on your lobby or your front desk. This helps as far as the education to the patient. What is chronic care management? What is the provider going to be doing? So we provide that to you as well. That's all part of some of the advantageous items that we supply to you. The consent form, currently we still prepare that consent form. We can continue to do so if the practice requests it. The talking points to help the patient enroll, we take care of all of that for you, and we give you instructions on how to proceed. We also give you a CCM script pad. This is a great reminder. You place it around various desks in the office. It's going to allow you to notate and capture time so no notes are lost anywhere in the process. So as far as the time tracking and care plans, I touched on them briefly. We have a picture on the right. This shows where the section where the staff would be inputting their time into the system, and we have a picture below on a care plan on how it's edited for a patient to be more personalized. So your staff is going to be very confident in navigating the platform, especially these two sections here that are listed. And immediately following the short initial training, you're going to have a firm understanding of the core elements of the chronic care management program. We do recommend a remote web training. It's very simple. We're able to share our computer screen, and it has worked very, very well. Short training window, quick turnaround. So we have a patient here, Irma. This is your typical Medicare patient. She has 2 or more chronic conditions, so she qualifies for the program. And like some that you find, she's really not compliant and active in her own care. These are some of the activities that you're probably providing on a daily basis. We have a cumulative time. So that's another point I want to stress. It's not 20 minutes in one. It's from the first of the month to the end of the month. It is based on the calendar month. Minutes are not carried over, but it is across your entire staff. So if you spent 4 minutes speaking with the patient and one of your staff members had to call the pharmacy, someone else filled out a form, made a referral, it's all added together and all counts as billable time. So it's really an effort across your whole practice. So with this one patient, we had 4 activities amounted to 30 minutes in a month. What we're finding is the average spent per month is 23 minutes per patient. So with our chronic care management solution, you're going to be able to coordinate care, you're going to capture and track time, be compliant with CMS requirements, you're going to be able to schedule tasks and run several reports to provide you with the necessary data to bill for the CPT code 99490, and in addition, the additional CPT code starting in a few months. This is a sample ROI for a practice. What we do is we break it out by your total number of patients, how many Medicare patients that you have, an estimate of how many would qualify, and what you could expect to bill once you're set up and established. An Amazing Charts sales representative will gladly put together a sample ROI for your practice based on the information that they provide to you. They'll be able to discuss it, go into detail. We could also give you a ramp on what you could expect to do in the first 90 days, the second, the third, and then at the end of the full year. So if you want to get an idea of what your practice would be able to generate based on your locality, an Amazing Chart sales representative will be able to put that together for you, schedule a demo accordingly. So we have two models of chronic care management that we're able to offer you. One is really what I've been discussing with you from the beginning, and that is utilizing the platform as a self-serve model. We show you how to track time, we show you how to do the care plan, input the data, run reports, and so. But there might be practices out there say, you know what, I just don't have the staff, I don't have the time to do this. We are able to offer you a premier version. And what this is would be a tele-CCM staff that consists of licensed RNs, CMAs, and pharmacists. Again, they're going to support the CCM requirements. They're going to collaborate with your staff. They're going to notify your staff of any occurrences based on the outreach communications that are taking place. So they will be able to coordinate care. They will operate in the background basically as an extension of your practice. And with the current 24/7 requirement for access to care, a dedicated phone number also would be provided to each of your patients that they would be able to call. It would go to one of these tele-CCM staff members. So two different options here. You're able to speak to your Amazing Chart sales representative. They could provide input on both, and by asking some simple questions, provide you on a path which model would be best for you. So again, don't forget the upcoming PriMed conferences. The next most recent one coming up, I believe, is in Chicago. You can go to the PriMed website to see the ones coming up. There's one in Boston in December, and any information for your CME credits. So just touching on a couple of the key benefits, we are HIPAA compliant, obviously. It is very, very secure. Convenient. We have some mobile apps that are available, again, for communicating with any of your ancillary providers. If you chose perhaps your patients' family members, if they're constantly calling the office, you're able to communicate with them within our platform. We're able to show you that. It is cloud-based, so you're able to log in and get your patient's status real time. Just log in anywhere you are, you have internet access, you'll be able to satisfy that requirement. As many users as you like. So again, there is no limit on users that are able to participate within your practice, and touching, again, very easy and efficient. That's what we're looking to get here. If you had any apprehensions about moving ahead with chronic care management, schedule a demo with one of your Amazing Charts representatives, and they'll show you again. This is what we're looking to show you today, to give it a shot, to move forward and reap the benefits of the program, especially with the new changes coming in 2017. So as a closing statement, the main point I really want to leave you here with today is that with the easing of the requirements that I have mentioned to you earlier, with the increased reimbursement, the addition of the new CPT codes for complex chronic care patients, now really is the time to move forward and get started with the chronic care management program. So Mark, I could turn it over to you if there's any questions that are waiting for me from the attendees online.
All right, thank you, Michael. If you have any questions, you can type it in the into the chat button down below, and either send it directly to me, and I can relay them over to Michael. We'll have the session open for questions right now. So just to reiterate, if you need questions, if you want to ask any questions, you can type questions into the chat field and send them specifically to me or over to Michael, and we should be able to read them aloud and answer them for you.
All right, this is Jameson, and I can take over. I see some questions coming in for you, Mike. The first one is, please define care plan.
Okay, define a care plan. So CMS does require that a comprehensive care plan is established for the patient. Touching on that I mentioned as far as a requirement for a patient to be eligible for the program is 2 or more chronic conditions, but we encourage any condition that the patient has would need to be addressed within the care plan. And this has a multitude of items as well, including psychosocial, items with the patient. So we have a list how to create a care plan with the practices, all the items that are involved to be compliant with CMS.
Great, thank you.
And just again to touch on that, I'm sorry, Jameson, the care plan does come down, as I mentioned, the problems. Within that care plan, the problems, all the items that you're addressing, it's the services that you're providing to address those problems. And in addition to the services you're providing to address those problems, it's the expected outcomes or goals. So it's sort of a cause and effect from beginning to the end. This is what the patient has. This is what we're treating you for. This is what we're going to be providing. And this is what we're looking to achieve. So in the care plan that we have, you are able to print it out. As I mentioned, you are required to give a copy to the patient, and it's really in a nice, easily read format. And that's the main point, is the last column is the expected outcomes or goals that you're looking to achieve to address those conditions.
Great, thanks. And there's a few more in here that I can address. One is the webinar being recorded? Yes, it is, and it will be sent out to all registrants after the presentation. There's a few questions on cost, and on cost, an Amazing Charts representative will be following up with you, and they can provide you with estimates based on your practice's needs. Another question for you, Mike, is how does the system work? Is there a timer? They want to know how to record the time that they spend.
Yeah, understood. Good question. So there is not a timer. There is no requirement from CMS to be a timer. You're going to be performing a multitude of items. So whether it's a phone call, filling out a form, making a referral, you're not always going to be in the office when these happen. You're going to have a busy office. The waiting room's full. There is no time start-stop function. So it is based on the honor system. If you spent 4 minutes filling out the form or following up with the patient and calling the pharmacy took 6 minutes, that's what we're looking. You know, obviously it's going to be a mental note on to look at your watch or a clock or your phone to determine what the time is. It is based on the honor system. You know, again, I do get asked, Mike, what is preventing me putting in 20 minutes if that's the case, if there's no timer? Well, you know, if you didn't spend 20 minutes, that's a problem, and that's fraud. You know, you're not going to do that. It is based on the honor system. Just make a mental note, notate it. Again, going back to the script pads that I mentioned earlier, you're able to notate this time, and you know, that is the recommendation and current workflow.
Great, thanks. And then just 2 more questions that I see through. One is regarding more documentation and information on CCM. So as I said, we will be sending out the recording, and we'll send out a copy of the slides as well so that you can review these. And also account managers will be following up, and they can provide you with some additional documentation. And another is asking for an example of a care plan. And again, an account manager will be able to provide you with some examples of that. So. Thank you for your time today, Michael. Great presentation. And if you guys have any questions, don't hesitate to reach out to the sales team at Amazing Charts. The sales email and phone number can both be found on the website. And as I mentioned, you'll be getting contacted directly to see if you have any additional questions. So we thank you for your time today, and we hope to see you back on a webinar again soon. Thanks, everybody.